So this is really getting started with our demo of our analyzer. This is something that will be released later this year. And the idea really is to have a very user-friendly interface and software where you can use, detect, and also clustering tools, but also have a good visualization engine. So basically starts with adding your repertoires of interest. So TSV files, any air format will do. But of course, for this demo, we're going to use an uploaded data set. So an existing data set, in this case, a vaccination. So it's a cancer vaccination example with 6 patients, 4 time points, and 24 repertoires in total. So these different repertoires, the first thing that we're going to do is to analyze these with ImmuneWatch Detect and with plus TCR, ImmuneWatch plus TCR to do the clustering. So all of this raw data is then processed. And once this computational work is done, we can really start analyzing. You would have different standard views, including, of course, the repertoire overview, where for each patient you see the different samples and also the number of clonotypes in each sample, and also other repertoire metrics. But we're going to take a deeper dive and look at, what can you do with the clustering and the antigen specificity annotation. So first thing we're going to do is to decide on which type of data source that we're going to analyze. Are we going to look at individual TCR clonotypes, or are we going to look at clusters or post-therapy induced clusters? And of course, you can also look at all of these separately. We're going to first start with looking at tumor-associated antigens, which are relevant for this cancer vaccine, and we're going to apply some filters. So the first one is we're going to select TCRs that have a score for the KRAS or WT1, common tumor-associated antigens, and we're going to select those and then filter additionally on their scoring. For example, we typically use a cutoff score of 0.2 and then select a timeline for each of these patients. So basically what you're getting here is an overview of the dynamics of the tumor-specific TCRs in each of these patients for these antigens. You can look at each antigen separately, of course, even look at it at epitope level. We also are including an agent to really help you to make this easier. So if we ask for exploration of clusters, for example, then it can get you started on analyzing this side of things. So exploring clusters, in this case now, every dot is a cluster of T cells, so a set of TCRs clustered together based on their similarity. Can even look at epitope-specific clusters and get some help also there. So this plot is then automatically updated to highlight cluster specific for this specific KRAS epitope. And each of these clusters we can analyze in depth. So here you see one of the KRAS epitope-specific ones, 51 sequences. Here you see what the basic motif is, and also where the training data is coming from to annotate this as a KRAS-specific cluster. And lastly, we can, of course, explore individual cluster graphs and then look at the sequence similarity and individual TCR dynamics within that cluster.